Good morning all. Model analysis form a very important part of diagnosis and treatment planning in orthodontics. This video demonstration brings to you metric measurement of arch length and tooth material done in arch perimeter and caries analysis. Arch perimeter is analysis for maxillary arch and caries is for mandibular arch. And they assess the discrepancy between tooth size and arch length. Tooth size of 10 teeth from second premolar on one side to that of the opposite side are measured. It is to be remembered that the tooth size is measured at the greatest mesiodistal width of the tooth. Measurement is done using a divider and transferred to a ruler before noting down. Then we sum up all the measurements to arrive at a total tooth material. Measurement of arch length is done using a brass wire from the distal marginal ridge of second premolar one side to that of the opposite side, or the mesial surface of first permanent molar when the tooth mesial to the first permanent molar is missing. Wire is stretched along the posterior teeth, touching the buccal cusp. In the anterior area, brass wire follows the original arch form regardless of how the teeth are positioned. If the incisors have normal inclination, then the brass wire is placed on the incisal edge of these teeth. If the incisors are proclined, then the anterior segment of the wire is placed in the cingulum. If they are retroclined, like in class 2 division 2, the brass wire is placed on the labial surface of the incisors. Now, for calculating the discrepancy, the tooth material is subtracted from the measured arch length. If we get a positive value, then arch length is in excess and space gaining methods are not required. If we get a negative value, then the tooth material is in excess. A tooth material excess of 2.5 millimeters warrant proximal slicing of teeth as a space gaining procedure. That from 2.5 to 5 millimeters indicates second premolar extraction, and more than 5 mm of tooth material excess indicates extraction of the first premolars for gaining enough space for aligning the crowded teeth or treating proclined teeth.